Hi, I'm Raquel Medina, physiotherapist and doctor in neurosciences. I welcome you to this first part where we will learn how to use Wecardio. We must remember that Wecardio is a small, portable device. We have it here, to be used to measure cardiac variability. Variability is measured through an electrocardiogram, but we must remember that it is not used to analyze or to diagnose cardiac pathologies. We will simply analyze cardiac variability to check for dysautonomies or to see the overall state of the autonomic nervous system. It should be remembered that this device must be placed between the second and third fingers of the hand, where the patient must hold and place them on the plate. Then we will carry out a 5-minute analysis to see the results afterwards. In order to use our Wecardio, we must have an application, an app, that we must download and install on our tablet. It can be installed on Android or Mac tablets. It is a completely free application and it's called Wecardio HC. Let's proceed to enter the application for the first time. Probably, when you get the tablet with the device, the application is already installed, but it is in a profile on a trial mode. The problem with this profile, although you can use any of the options, is that it will not give you a complete record of the variability. In other words, it will not give you the results report, which is what we are interested in. For that purpose, what we must do is to access the small circle at the top left, where we see a human silhouette, and there we have to choose the type of session. Chances are that the first time you will not have any profile created, so you will have to sing out. You have to fully exit the test session that come pre-installed. And here, what we have to do is to sing up. This is the place to start. But you must click on Register Now to create your own profile. To create our profile, we must use an email address that is common to all of us, or we create a specific email for Wecardio. I will proceed to create a new profile. In this case, I am going to use an email that I use often, and I must create a password. Remember to set an easy password and that all your team to use this device with this application know these credentials. Once you have chosen the email address and designed a password, we accept and go to login. Once we have created our new profile, we access, and then we can see in the upper left circle, where the human silhouette is, that we are connected to the one we are interested in. We will see that it has a blue tick. Remember that it is very important that you are connected to the profile you've created, not the test one. At this point, we already have our profile, so we can proceed to analyze our patient. We already have our profile created, but let's configure how we want to analyze. To do this, we will go to the bottom bar, where it says, Me. We will scroll down and go to the option, Settings. And in Settings we can configure different things. In this case we will be interested in the configuration of Physical test, which is the third option. And here we must make sure that the HRV test should be set to 5 minutes. The length is 300 seconds. Once we have configured our HRV test length to 300 seconds, we go backwards. And we are leaving to check. Once we have configured that our analysis should last 5 minutes, we must synchronize Wecardio with the app. Synchronization must be done via Bluetooth. Therefore, it is very important to have the tablet's Bluetooth enabled. To configure our Wecardio device to this device and this application, we must return to ME. Here we are going to the fourth option, which is Device Bind. We must click and it will start searching for a nearby device. In order to search for the device, we have to place our fingers on the Wecardio plates. Once the fingers are placed on the Wecardio, we see that the application displays the device that is nearby. In this case we are going to click on it and it will be synchronized. We now have our Wecardio device synchronized with our application. It is very important that if we have different Wecardios in the practice, we must synchronize each of these devices with the tablet. Once we've synchronized, we go backwards. We are now ready to begin our analysis of the autonomic nervous system. We see that there are 4 analysis options. The one that will interest us in the option that says, ANS evaluation. You will see that the initials are in English, autonomous nervous system. It is the orange option. Once we have prepared our patient on the stretcher, relaxed, we can begin to evaluate. Once the device has been grabbed with their fingers and is now securely in place, we will begin to evaluate the analysis of the autonomic nervous system. Click on the orange option. Sometimes we have to wait a few seconds until the device starts evaluating. And the evaluation of the autonomic nervous system begins. Remember that the patient must be relaxed, without talking and without moving during these 5 minutes. We also recommend that they do not over-tighten the plates, it has to be a soft grip. In our analysis screen, the waves that we see in the grid are basically the electrocardiogram. We will see if the patient moves or speaks, these waves can be altered. It is very dangerous to talk or move, especially since it may after the outcome and we must do it again. At the top of the screen, you will see that an orange bar in a circle is advancing. It is the time. You will also see that the minutes remaining are shown below, in this case 3:44. In the center, in large orange, you will see the beats per minute, and just above it you will see the battery icon. This will tell you when to charge your Wecardio device. Remember that in the box you have a white cable which is for charging the device. If on any occasion the patient moves or over-tightens or talk, we'll see how the analysis, as seen on the screen, goes out of adjustment. This will produce biases and errors in the result. If it happens, you must stop and reanalyze. Once all the concepts have been learned and knowing how we should perform the analysis, we can proceed to evaluate our patient and will wait for 5 minutes for the entire evaluation to be completed. Once the 5-minute analysis has been completed, it will take us to this screen. As you can see, we must configure in the basic information, our patent's data. And we go to the option switch. In this option, if we have already made different analyses, we will have a list of all the patients we have been collecting. Because in addition, it is recommended that this analysis should not be done only once, but to be done prior to all treatment sessions, to be done in the middle and to be done at the end. It can also be done simply in the beginning of all sessions and at the end of all treatment sessions. In this case, if I want to add a new patient, because it is the first time I do it, I'll go to the option Add. And here I must enter my patient's data. In this case, as it is a test, we will put these data. We must enter the last name, first name, gender, and date of birth. The rest of the data, such as identification number, email, or address, is optional. And click on Send. We already have this new patient registered here, which is called Patient 3. Well, I'm going to choose this one, and I go backwards. We see that patient number 3 has been recorded. Here you could select some symptoms. However, we do not recommend it because there are only a few symptoms and we are not only going to work on cardiac symptoms, we are going to work on other series of symptoms of the autonomic nervous system. We can select nothing in this section and click on Send. We will see that the entree analysis begins to be recorded, both the electrocardiogram and our report. This is the report we are interested in, the report. We can see it here on the fly and analyze it. Or if I want to visualize it at another time, or look for it at another time, if I return to the general screen, I will find them very easily in record. We see there that in record we have the evaluation of the autonomic nervous system, carried out today at this time. In order to understand and analyze the results we have obtained, you should watch the second part of this video. Thank you.